Hello, good evening, everybody. This is Abid at the Biomechanix clinic in Coventry. Tonight, I'm very pleased to introduce you to a good friend for a long time and a very, very highly experienced clinician, one of the best physios I've ever come across. He is Jonathan Dove. He works locally at University Hospitals Coventry in an advanced practice role. I'll let him talk to you a bit more about that. And he's available here at the Biomechanix clinic for appointments. So if you would like to see him, please get in touch. All the details are on our website and social media feeds. So let us know if there's anything we can help you out with. Okay, so let me let Joe talk a little bit about himself. So Joe, good evening. Thank you for joining us tonight from home. I'm sure you've been working really, really hard through lockdown, and I believe you've been redeployed to different departments. So you've not really been doing much in your regular job, but hopefully things are settling down, and with a bit of luck, we'll start to come back to some kind of normality over the coming months. So tell us a bit about how lockdowns worked out for you. How has your job function, job role changed since that time?
It's been very different, yeah. My main role at the moment is advanced physio within NHS mostly. Part of that I work in the spinal services at university hospitals alongside the consultants in clinics, but also have a role within the physiotherapy department treating predominantly back and spinal pain, but also a range of other conditions. I also do run spinal injection clinics in theatres at the moment, alongside the peripheral injections that I do both in NHS and privately. This has been really supported by my independent prescribing qualification that I obtained a number of years ago. And so it's unusual that we're able to offer what we can at the Biomechanix clinic in terms of the range of injections and injectables without multiple visits to different clinicians. So I think that's really something very positive to come out of NHS and private practice, actually.
Yeah, of course. I mean, you can get immediate access here, timely appointments within a week or two. And a lot of the time that can be backed up with sonography. Of course, we have Adrian Berman. We should probably introduce everybody to the upper limb clinic, because we've not really launched it yet, but it's pretty much ready to go. So that involves a full assessment here with Jonathan Dove regarding any upper limb, well, lower limb, any part. And of course, Jonathan is really very experienced with spines particularly. And as you heard him say there, he does a lot of spinal injections, which is really advanced practice stuff. That's usually consultant level stuff only. So he's done a fantastic job of flying the flag for our professions and helping to boost and get such treatments underway. That, of course, alleviates a lot of pressure off the consultants, I'm sure, and it gives people more choice of appointments to get in for. So here, if you decide you have such a problem, you can expect a full assessment with Jonathan to try to help diagnose your condition, and then Adrian works alongside Jonathan and will be there to give you a scan, ultrasound scan particularly, which is useful for probably 90% of musculoskeletal conditions. And so you've got two practitioners with great experience, over probably 20 years each, looking at you at the same time, and that is your assessment, diagnosis, and quite often the treatment as well is all done on the very same day and same appointment. So that's quite unique. I don't think you'll find anything like that in NHS land or many other private clinics around, as far as I'm aware. So that's something that we're really keen to fly the flag with, and you'll be seeing more popping up around that over the coming months. So with the other clinics we do. So any other specialities you want to let people know about? I mean, spines is a huge area. The research probably suggests nearly over 90% of us will suffer with back problems at some point in our life.
We do, yeah, really common. Certainly previously, up until over about 10 months ago, I was treating all peripheral and spinal problems. I think the opportunity to work alongside Adrian again, as we have done in NHS land before, was fantastic, and to have the availability of him, as we've done a few times already, to have him on hand to scan and then to treat within the same appointment has been really positive from both the clinician aspect, which is something that we rarely get that sort of timely treatment and opportunity to do in the NHS, but also actually for the patient's benefit. We can really specialise treatments and get the most out of the appointments that we can.
Yeah, I mean, usually you'll wait probably a couple of months for an assessment appointment. From that, you'll get referred for a scan. You may need to wait a couple of months for that, and then potentially you've got a bit of a wait to get back to see the original assessor to sort of go through the scan and decide what the appropriate treatment for you is. So it can take anything from 8 weeks to 6 months in a lot of cases to complete that circle. So of course you just come here and it's all done on the same day. So it's a really, really valuable service, and hopefully we're serving the community at large here in Coventry, Warwickshire. Jonathan, do you want to just run through maybe a bit of a list of the type of conditions that you see or you're happy to see, and things that you think you can help with? Maybe start from the top and we'll work our way down. Do you want to just maybe name a few conditions that people could come and see for help with?
I guess starting predominantly would be just central neck pain. I think particularly at the moment we're seeing a vast swathe of people with neck problems, because we're all now sat at home working in front of our desks and perhaps working more hours than we were before, and not moving so much. And so we're seeing a lot of just as your standard mechanical neck and lower back pains that often come hand in hand, really. So definitely that sort of thing we can really offer good advice for. Along with that, we often see a lot of shoulder problems. So we see a lot of conjoint problems with cervical, your cervical spine, and shoulder and arm pain. So radicular pain, so nerve type pain in the arm, or just your straightforward shoulder and overuse injuries around elbows and wrists. There's often a lot we can do with those sorts of problems, both from a physiotherapy perspective, but also from an advanced practice perspective, perhaps with acupuncture, laser therapy, injections if indicated. So any spine condition, obviously we see a lot of people that have had a disc prolapse perhaps, or just general mechanical low back pain. As Abid said, vast majority of us will have a problem at some point in our lives, and I think we strongly support getting some early and quick intervention, because we know that it prevents further problems in the future if we can manage it well at the first opportunity. Along with that, really, any hip problems, so tendon problems, particularly mild to moderate hip arthritis, we can treat very effectively with physiotherapy regimes, along with joint appointments with Abid as well. So the orthotic side of things and mechanics, we can really put a good package of care together and treat the top and the bottom end, really. I think to list all conditions, we'll be here for a long time, I suppose, but that's certainly the predominant problems that we'll see, along with knee injuries, actually, particularly as people, the summer months come around and people are trying to do a bit more. So not only do we treat injuries, but we'll also help advise in terms of actually general activity and how to perhaps go about starting running, or general conditioning and exercise pre-activity. So sometimes the best solution to injury is never to get one. So actually we can do a lot of strength conditioning work, advice, and biomechanics input before you even start or on your endeavor, and really make it as smooth and comfortable process as possible, really.
And of course, people ought to know that we worked together for several years in the foot and ankle and lower limb department, and we had a fantastic relationship, and it was just thoroughly enjoyable, and I think highly successful working together and have that joint clinician approach, which again is going to be more difficult to find in NHS than just because of the inevitable pressures that we're already under, and the growing pressures because of this year plus of COVID that's kind of halted a lot of things in their tracks. So it's difficult to get timely access again over there.
Yeah, definitely, and having worked and seen it work well before, both at the front and back end of problems, and really trying to limit the chronicity of issues that people have, I think it's something very unique, really, that we can offer.
Brilliant. Okay, so hopefully that gives everyone a flavour of the type of things we can offer. I think we'd like to know a little bit more about yourself as well, Joe, just so people can familiarise themselves and put a name to the face. So when you're not working and treating people and bodies and fixing things and injecting things and all the rest of it, what do you like to do in your spare time?
Well, I've got married with two young boys, so they take up a lot of our time. We have 4 horses now. Both my children ride them, and my wife. I just get the general lumping jobs of mucking them out and walking around a lot. Personally, I cycle a lot. I run. I climb. I've played both hockey and cricket to a high standard before, so certainly have a good understanding and working knowledge of all of those sports, from both just personally wanting to do more of them, but also bringing it into the working field as well. So as much time as I can, I spend doing sports, really, as much as anything, and family time really takes up the rest at the moment, which is nice. But busy.
Yeah, well, yeah, absolutely. Everyone's up to the eyeballs with family time, I think, at the moment, with what's been going on in lockdown and whatnot. So yeah, pretty difficult. Yeah, that's good. That's great information to hear. I think we've covered most of the bases. Today was really a brief introduction. I mean, with a lot of other of our colleagues here at the clinic, we've been going on to do further programs. So in future, maybe we do a program about back pain, and just do 20 or 30 minutes. Sort of hints and tips perhaps for people to either help avoid getting problems, as you mentioned earlier. Prevention is the best cure, or even once they have developed a problem, what signs to look out for, when is it serious, when you need to go and seek medical attention, and when you could perhaps think about going privately and just getting some treatment instead. Anything else you think we need to cover there, Joe? I think we've covered.
No, it's most things, haven't we? If there's anything particular people want, then they could drop a note, and we can try and organise something over the next few weeks for a bit more information for people. Yeah.
So just so you guys know out there, if you think you need to see Joe Dove independently, you just look at our website or give us a call at the clinic here, and we can book you in for an assessment with Jonathan. If you quite fancy the idea of a joint assessment, either for the upper limb or lower limb clinic with a scan, we can organise an appointment for you with Jonathan and Adrian at the same time, so you get 2 brains for the price of 1, and a full assessment and potentially treatment on the same day. And also myself and Jonathan work together very closely with joint assessments for a lot of lower limb, foot, ankle, knee, hip and back problems too. So if you think any of that sounds appealing to you, or something that we could maybe help you with, please get in touch. All the details will be flashing on your screens after the show. So thanks again for joining us tonight, Joe. I know you're absolutely chock-a-block busy, and it's been a while to try and get this time together. So I'm very, very appreciative of that. And hopefully you go on to have a very good evening. We'll end the broadcast there, but if the demand's there, hopefully you're happy to come back and talk a little bit more in detail about specific conditions.
Of course, yeah. Anything that people want, we can organise for sure.
Fantastic. Thanks for your time, Joe. Much appreciated.
All right. See you all later. Bye-bye.
Yeah, thank you.